Namaste, namaste, good evening, everyone. We are late by 1 hour because of various reasons, and today is World Brain Day. This is Dr. Mayur V. Kaku. I am a neurosurgeon as well as a yoga therapist. You are at Yenri channel. Yenri stands for Yoga Environment Neuroscience Research Institute. And with me is my better half, Soumya, Dr. Soumya Shri. Soumya, please introduce yourself.
Namaste, I'm Dr. Soumya Shri. I am a child and adolescent mental health professional who treats children who have developmental and behavioral issues. So I think, like Mayur rightly uh, tells about us, Mayur basically treats hardware of the brain, and I treat the software of the brain. So here we are together live, wanting to talk about World Brain Day of 2024.
As you can read here, the theme for this year is brain health and prevention to protect our future. Today, Monday, July 22, 2024. Soumya.
So the theme for this year basically is highlighting how all the organizations which are catering to brain health, whether it is the World Health Organization, World Federation of Neurology, and many other prominent organizations which are working towards the cause of helping the community and the society at large to have a healthy brain, are coming together to help us understand the need to prevent brain diseases. And this is basically done by spreading awareness about brain diseases, how we can prevent all of these brain disorders, and sharing some healthy behaviors that can help us prevent brain related diseases and illnesses in our lifespan in the long run. Mayur, over to you.
Yes. So, what we need to do is we need to create an impact on all the people who are there on the planet. Why? Because recently we went through a lot of data, and that data showed that around half of the population, their central nervous system is getting damaged, their brain is getting damaged. That is why, at all the levels of existence, financially, socio-economically, socially, and so on and so forth, like there are continents who are very forward, there are continents who are not so forward, like America and Europe. They have a lot of facilities available, but Africa and Asia, they struggle. And in that also, many countries are struggling a lot. So we need to bring a balance, and we need to send this message of brain health and prevention to each and every corner of the planet, to each and every person on the planet. Soumya.
Yes, so just to understand what is brain health. So the World Health Organization, when we were, I think, medical students, Mayur, we have read about what is health, right? So I think today is the day where we are highlighting what is brain health. What do we mean by brain health? So brain
Yes.
health is basically a state of brain functioning across various domains. And these domains include cognitive domain, that is your intellect, your ability to think and analyze situations, your sensory domain, the way we perceive different senses in our environment, social and emotional domain, how we mingle in the society, how we express emotions and our feelings, and then behavioral domains and motor domains, allowing a person to realize their full potential over the life course, irrespective of whether they have or do not have any disorder. So it is basically the brain's ability to function at its fullest across all of these domains, whether or not there is presence of a disease or a disorder, and that is what is being highlighted as brain health. And this brain health is basically achieved by a constant, continuous, dynamic interaction between different determinants in a person's life, the way the person is in the environment, in the community, and how each person's context leads to a lifelong adaptation of brain structure and function. So, based on what we see, based on what we experience, how our brain continues to adapt throughout our lives to function, both in terms of structure and its ability to function. So, in order to optimize this brain health and improve both mental and physical health of the brain and of our own selves, and this in turn creating a positive social and economic impact on the community, through which all of us can contribute to a greater well-being of the society and help to advance the society overall when we all have a better brain health. So therefore, the significance of understanding why this is important and celebrating or observing World Brain Day today. And that is what we are bringing to all of you.
As I was discussing about various statistics, you can see that 90% of the strokes we can prevent, 40% of dementia cases we can prevent, and 25% of epilepsies we can prevent. Prevention is so important. If we prevent, we are decreasing the financial burden not only on the individual, but also on the family, society, and the nation. And not only on the nation, the whole world. However, there is a gap. This gap is about how many professionals we have to cater these kind of neurological or brain related disorders. As you can see, 3.1 neurologists per 1 lakh people. It's very less. Anyone in low income countries, it is further lesser. Another thing which happens with low income countries or low middle income countries is that those who specialize or super specialize as doctors, they tend to run away from their underdeveloped nation to the developed nation. Me and Soumya, we have taken conscious decision to stay in our country, despite many of our colleagues going away and doing well in various developed nations. Do you agree to that, Soumya? And can you please reinforce this fact
Yeah,
to our
definitely.
listeners that we have taken this conscious decision and we need your support in expanding the work and catering to the larger masses through Yenri, through our fund of knowledge which we have in terms of neuroscience. Soumya.
So, if we are just looking at the burden of disease of the brain itself, morning Mayur and I were reading through this, and it is truly mind-boggling to see these numbers that 3.4 billion people had nervous system health loss, and 11 million individuals died from a nervous system condition. And this was a global burden of disease study that was conducted in 2021. And if we see these numbers, 3.4 billion, Mayur, like you said in the morning, is half
Half,
of the Earth's
half of the
population.
population.
So it is really mind-boggling to see these numbers. And if we see 84% of stroke DALIs were potentially preventable, right?
Yes.
And it can be prevented by reducing exposure to multiple risk factors. I think we are going to discuss some of these risk factors in the upcoming
Yes.
slides. But it could be possible for us to reduce some of the diseases like stroke, like Alzheimer's disease, some dementias, multiple sclerosis by reducing some of these risk factors, including very simple things like sleeping better, not being in socially isolated situations, reducing the stress levels overall. or preventing smoking and some of the lifestyle related disorders. And all of these in turn can truly contribute, and there will be a huge jump in numbers, because not all of these are truly genetic, not all of these are truly something that is because of an error in the way somebody is born or somebody's brain is developing. A lot of these have environmental risk factors that can be prevented overall to improve the society's health, and brain health in particular.
So as you can see, most important aspect is to catch early, early detection and effective management. Both these things are very easily accessible in developed countries. In developing countries, this is where a problem arises. I will tell you that even doctors in developing countries, like me, like you, we have difficulty. Recently, a very senior faculty I had operated in my own medical college here, and he was not ready to undergo MRI. Let me be very frank. And he was telling that I will take paracetamol and I will sleep for 2 hours and I will be all right. However, as we saw, he developed increased intracranial pressure symptoms. And at that time, it was compulsory to do an MRI and find out what is going wrong. So you can see the knowledge which we have can be sometimes counterproductive to all of us. And if an educated person like a doctor is also not ready to undergo investigations, forget about the normal public. So this is very big challenge that for early detection to happen, people have to comply to various screening procedures, to various investigations, to the knowledge which is being shared to all of them with open-mindedness, with scientific approach, so that if we detect something early, we can manage that also effectively. Soumya.
Yes, I think if we have to prevent early and detect early, the most important thing is to be aware about it. So, again, we are reinforcing the fact that by being educated, by being aware on how to prevent all of these things and the importance of brain health, definitely we can go a long way in picking up things early, being more open-minded to suggest to people to prevent it, to stay away from some of these risk factors, develop better habits, develop better lifestyle on a daily basis, to be able to prevent
Thank you.
brain health
Very
related
nice.
disorders.
Yeah. So we have 5 people on YouTube. Gautam is saying Namaskaram. Namaskaram, everybody. Thank you very much for joining us so late. We will not disturb your sleep much because to prevent and promote brain health, your sleep is also equally important. We are going to go through these slides later on. You can share it, you can review it. And the idea is not just to go through this video just for the sake of gaining some theoretical knowledge. The whole idea about this video is to we need to reach to the masses and to act towards the improvement in the masses. The next slide, which is there, is about socioeconomic status or geographical location. That is what we have to improve our reach to each and every corner of the planet, and we should be able to help people to prevent disorders of the brain. Soumya.
Yes, and of course, not just being aware, all healthcare professionals, researchers who are working in this area, and also policymakers, whether it is government policymakers, health related policymakers, budget related policymakers, all of these people play important role in addressing the needs of our brain. And I think Mayur will come to that later on as well, right? In our future slides, where we'll talk about
Yeah.
how all of these people play an important role in different
Yes.
aspects of facilitating good brain
Yes.
health.
Yes. We as doctors, me and Soumya as doctors and researchers, we can influence all of you the normal public about various aspects of brain health or overall health and various diseases. Through that, we want all of you to be alert, and not only alert, to prevent various disorders. Recognizing brain health as a fundamental human right is the core of our mission on this world. The hardware also has to be good. If you see any car, if the material of the car is not good, the smoothness of running of the car is also not going to be that great. The experience of being inside the car while it is being driven is not going to be that great. So same way, the brain health is important for the mind also to work properly. And as we move on, we will come to know about this further. So Soumya will tell us what are the things which we can do to improve our brain health now.
Yeah, so of course, prevention is the key for anything, not only brain health, but even physical health, mental health. Prevention is the key. So, in order to prevent developing any issue and maintaining optimal brain health, what some of the things that we can do as listed here: one, have regular exercise, yoga, pranayama, meditation. And it is well known that physical activity of any form increases blood flow to the brain, promotes neuroplasticity, and enhances our cognitive ability. And apart from this, it's also extremely important to prioritize sleep. And when we are prioritizing sleep, like through Yenri, we have regular Brahma Muhurta yoga that is conducted. Um, it is important to have this sleep in the regular circadian rhythm in order to maintain all the hormones of our body in good synchrony. So, one is to have good quality of sleep, but it is again important that we are synchronizing that with our circadian rhythm in order to support proper memory consolidation, processing of information, and removal of toxins from the brain to facilitate brain growth and maintaining brain health in a proper way. Along with this, eating a balanced diet. Again, it's very, very important. It's not just for your physical health in terms of your muscles and body, but it is very important to fuel brain with good nutrition, good nutrients in order to have optimal and cognitive functioning. Just as a child psychiatrist, I can tell you that there is enough evidence to show that when children who are growing up, when their brain is growing and developing in such a rapid speed, when they are exposed to junk food, with lot of preservatives and some of these added food flavoring substances and food colors, all of these things have been shown in research very, very often to affect brain development, to affect children's attention and concentration, to affect the way their memory is stored, and all of these things. So it
And
is very
unfortunately,
important.
the parents, they find the shortcut to, keep their children quiet, and they very easily open the packets and they keep on distributing these unhealthy stuff to their children. It's very
Yeah.
unfortunate.
And it's very unfortunate that quite often, Mayur, I think we have also seen in some of these vending machines, even
Yes.
inside hospitals, when there are vending machines, we see most of the packaged food that is being
Yes.
sold even in
Yes.
these machines. So it is really very unfortunate.
We can continue this discussion towards our own colleagues, doctors. We as doctors, our colleagues, we see them eating unhealthy food. Many of the colleagues, they eat high sugary drinks, Coca-Cola, Pepsi, Thumbs Up, Mirinda, Fanta, so on and so forth. They quench their thirst with all these soft drinks or some very high sugar chocolate drinks, which are actually not healthy for long term. Okay. And unfortunately, doctors do not have time to eat, and they keep on eating this unhealthy stuff for a long time. And that is why the overall lifespan of doctors is far lesser than the normal population. It is around 59 years of age. It's very alarming, and me and you, both as doctors, we have to spread awareness amongst our doctor colleagues as well. There are few more things as we see that we have to become mentally active. Many of us, we become mental uh, fog is coming, and we become very foggy, and we stop doing new things. We keep on doing the things which, keep our limbic cortex engaged, like browsing through Instagram, browsing through YouTube, or some kind of addictions which people develop. And because of that, you can see that they become mentally inactive. We have to challenge our brain by learning new languages, new puzzles, new games, so on and so forth. That will help us to improve our creativity. We need to learn to manage stress. In our life, all of us go through a lot of stress. It may be physical stress for some, it may be mental stress for some. It may be both, or maybe few more types of stresses people have. I have seen people with social stress. I have seen people with spiritual stress. And these are all very interesting kinds of stress, which all of us need to learn to manage. Okay. And then being socially connected. This is very interesting part. In recent past, I have come across the cases related to social disconnection also. And it's very interesting that over a period of time now, specifically, I am very close to the medical community. I myself being a doctor, working in a medical college. I can tell you that doctors are socially isolated. Doctors, all of us are socially. You may think, oh, no, doctors are so social. They have to daily see patients, so on and so forth. But it is actually counterintuitive. It is very counterintuitive where doctors, because of so much of social exposure, internally they are socially isolated. They are socially disconnected. And there is that exhaustion which is there in terms of communication. The doctors, at the end of the day, they don't have time to communicate with their own family members. And that is a very interesting disconnection. So I am bringing both the worlds together here, like trying to bring normal public as well as the medical population also, because somewhere, Soumya, what we think is that, doctors have to actively change their own lifestyles so that they can influence the lifestyles of normal public. That is what is the message which we want to convey here. Yeah. Soumya, over to you.
Yes, and in order to protect your brain, even physically, if you have to maintain good brain health, then it is essential to protect your head in the first place. So, wearing helmet during riding vehicle or playing sports, using seat belts when you're driving, and taking precautions actively to prevent falls and head injuries is extremely important. Uh,
Around 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 2.5 lakh people, they die every year, okay, because of head injuries.
yeah,
And a lot of human life is damaged because of head injury. Okay.
definitely.
Yeah.
And I think most of these head injuries might be happening because of addictions like alcoholism and drug use. So again, that is where the next point comes into picture, where avoiding things like smoking, alcohol, and other related substances could definitely help prevent some of the harmful effects on the
These are
brain.
direct poisons. These are direct
Absolutely.
poisons to the brain. These are direct poisons to the brain. And we happily, many of our colleagues or many of our fellow human beings, they happily consume these things thinking that they are getting high from it. And there's a very important aspect of addiction psychiatry which comes into play. And nowadays, we are seeing even children getting affected because of so many these kind of addictions. As the world is progressing so fast, the access to such kind of substances is very easy nowadays. And somewhere parents are also so ignorant that they are allowing these things to happen under their nose. I through this platform, we urge all the parents to keep a close watch on their children, what they are doing, exactly what they're doing. Soumya.
Yes, and I think the last point is to stay hydrated and prioritize mental well-being. Again, this is very, very essential because you have to prioritize your own health first and seek support when needed. Talk to friends, talk to somebody who can help, talk to your own family members, discuss whatever is going on, engage in activities that can bring joy. So instead of coming home from work and settling down in front of, so I had a very interesting case where one of the children had some mental health issue. And when I started talking to him about why he is having these issues, what I came to know was his father, as soon as he came from work, would just sit down on the sofa, turn on the TV, and start watching TV as soon as he comes from work. And this child would be actually sitting at home and waiting for his father to come from work. And the child actually expressed to me saying that for my father, news on TV is more important than me. And that is how he started having some mental health issues. So I think rather than falling into, like Mayu rightly said, some of these limbic cortex influencing situations and addictions like screen time, excessive social media use, internet addiction, gaming addiction, drug use, smoking, alcohol, and all of these things, it is essential to prioritize physical, mental well being, social well being, and spiritual well being to overall have a good, healthy brain.
Great. Thank you. Thank you, Soumya. Murthy ji, namaste. At such an 10 o'clock in the night, you people have joined in. It's beautiful and amazing. Now, me and Soumya will go through just, two more slides are there. One of them is this one, the framework of brain health optimization. We invite all of you to participate in this brain health optimization with all of us, with me and Soumya. How we have to do is because, this brain health will help all of us to enjoy our life. How? That is through creating better physical health, through creating healthy environments, through creating safety and security at workplace and home, through continuous learning and connection, through access to quality services. Now, as you can see through yoga, we are able to address so many aspects of health, brain health. Okay. But still, there are some points which we need to cover. And as our bandhutva in Yenri will keep on improving, we should be able to put this framework into place in the society. So you can see here, Soumya, you want to comment on this?
Now, I think we have discussed all of these aspects. Again,
Already. Yeah.
already improving a healthy environment, physical health, having proper policy making towards all of these things, and having access to quality services, whether anybody is living in urban area, rural area, whichever socioeconomic
Or
class,
any continent, like a developed
any
continent to
continent.
developing continent.
Yes, yes.
Yeah. So these things, no, enhanced well-being of our brain or our whole body is going to have social and economic benefits, is going to have improved health, which will help us to definitely lead a better and a beautiful life. So you can see here, this is the last slide where physical health, very interesting points. Those who are here, please put a close watch on this, and you can see Soumya would like to cover the physical health aspects.
Sure. So, like the title rightly says, these are brain health across the life course, which means right from the time of conception of the baby in the maternal intrauterine environment, even within the womb of the mother, that is when physical health will start, of physical health of the brain will start. So, right from there, moving on to the influences of environment, how nutrition will influence the various kinds of infections that we are all exposed to as the brain is developing and growing, non-communicable diseases, meaning diabetes, hypertension, cardiovascular diseases, and similar other lifestyle disorders, how they influence brain health and our own health behaviors, and like we already mentioned, preventing head injuries and falls and other traumatic injuries to the brain are all coming under the physical health of the brain, where we are protecting the brain to
Through
grow,
Yenri, yes, yes. Continue.
to basically grow optimally and be healthy and do its work to the fullest potential.
Through Yenri, we intend to offer various workshops and programs for maternal health, that is Garbha Sanskar, which we can say, and we want to conduct various workshops for young couples who wish to conceive and who wish to bring a healthy baby to the world. We wish to conduct various nutrition related workshops, and already through our Brahma Muhurt Yoga and through Panchakosha Viveka, we are influencing variety of people to improve their lifestyle and avoid non-communicable diseases and improve their health behaviors. Another thing I would like to mention here is Ram Ayarji from for facilitating this process. And as we move on, we see that we will be conducting more and more social awareness programs through Yenri and improve overall brain health of the society, not only just individuals, but of the society. So healthy environment, how do we use, how do we bring chemicals into the life, how we avoid these chemicals into the life, that is going to create our healthy environment. We should protect ourselves from the radiation. We should create healthy and safe workplaces. Agricultural practices should be refined. One of the most important causes for Parkinson's disease is the use or absorption of excessive amount of pesticides in our body. Previously, there was something called as DDT, and now DDT is not used so commonly, but it was responsible for many cases of Parkinsonism. We have to improve air and water quality. Soumya, when we were reading, do you remember that how many percentage of people are breathing bad air quality?
I think we read that 99% of people on the planet.
99% people are breathing bad quality air. We really have to think and do things for improving air and water quality. We have to create a stable climate. We have to improve the access to preserved nature, and we have to, health supportive environments we have to build. Soumya, you want to speak about further things?
Sure. So again, to keep our brain safe, it is necessary to be physically safe, have financial security, of course, to have access to services and so on, and also to be in a situation where you're not in the middle of a humanitarian crisis or an emergency, like how we are seeing wars happening in
Wars.
different parts of the world,
Yeah.
and being in emergency situations. So it is very difficult for people in those kind of situations to really have optimal brain health. And again,
Yes.
moving on to the next determinant, that is learning and social connection. So through education, through constantly engaging ourselves in the process of learning, it is very, very essential to be in that position where you're not allowing your brain to be lethargic, just not engage in anything, but actively learning something, having and maintaining adequate social connections, social networking, and being in the middle of social situations so that you're not isolated and not losing your brain health in the real sense.
Why this social connection and social networking, all these things have come into suddenly into the vogue is because recently we have seen corona pandemic, COVID-19, and during that time a lot of things have happened, and suddenly we have realized how much important social connections are, social networks are. Many people did not have support during corona pandemic, and they succumbed to it because of the same. So it's a very interesting point, and our country is so overpopulated that invariably we don't have any deficiency of social connections. And however, still, means there are issues. Urbanization is developing issues regarding social connections and social isolation. But it's beautiful that we are overpopulated, but because of that, we have a lot of facilities also in terms of social connections. Now, finally, coming down to the access to quality services, and this is where WHO uses this very important word, and that is where Yenri stands for integrated care at all the health and social care levels. Integrated care. The care has to be integrated. It's not like only one type of care needs to be provided or only one person will provide the care. It is about care to be provided by variety of people, by variety of experts, through variety of treatment modalities, and everybody in the society has to contribute to this care. As many a number of times I have mentioned this, that even security guard of the hospital is also responsible for the care of the patient. Nursing staff is responsible for the care of the patient. Doctor is responsible. Not only doctor, nursing staff, security guard, and all these people, even the patient's relatives themselves are responsible for the care of the patient. Why? Because once the patient gets admitted in the hospital, they forget that they are the caretakers. They think that a whole and sole responsibility of patient to improve is of doctors and nurses, which is not true. And somewhere there is a disconnect which I have observed. And that is why integrated care includes each and every one person around the patient. Skilled workforce has to be developed. We have to have access to the medicines, diagnostics, and health products. And finally, if you see the last one, that also is written carer support. I have seen many people getting exhausted being a caretaker, and they themselves succumb to various disorders. That is why we need to know and we need to create a facility for people who are caretakers in the health of patients. So thank you, all of you. Wish you a very healthy brain on this auspicious World Brain Day, and rest of the life also your brain remains healthy. So ultimately your mind also remains healthy. Soumya, you have anything else to say?
Thank you so much for joining us and paying attention to our work and our request to have a healthy and a happy brain. So, all the very best to all of you.
Thank you. Thank you. Thank you very much, everybody. Shubharatri. Sleep well, 7 to 9 hours. Rise early, do yoga, have a healthy lifestyle. Thank you. Thank you. Thank you, everybody. Have a nice day.